Okay, today we're going to be talking about treatments, specifically looking at medications and reactions and being brave to try. And that's a big universe. It definitely is. So, a little bit about me. I'm Roselle O'Brien. I'm in the US. I have MCAS and a bunch of other diagnoses that go along with it. I'm also a teacher, nurse, a therapist. And most importantly, I'm here and I always to help with mast cell activation issues and support people and on their journey of learning in life. So I have the PDF of this we're going to share. So you'll have copies of it. And here's a little roadmap of what we're going to be talking about today. We're going to talk about mast cells and triggers and reactions, the individuality of health, treatments, medications, and some strategies. There is a lot of information there. When planning this, I found there were a lot of threads that were involved in, it seems like a simple thing about medications and reactions and being brave to try. But there are a lot of threads that are involved in that. So the first part of it, and the biggest part of it always, is education is key, and learning the most you can about mast cells and what's happening in your body. And that's a really good place to start. And that's a little theme throughout. But mast cells are white blood cells. They're located in the connective tissue throughout your entire body. They're in every organ system, including the brain. They're part of our body's immune response, part of the body's inflammatory response, and the body's first responders to what they perceive as dangers and threats. They provide the first line of defense against perceived dangers or threats. They help protect the body against things like bacteria and viruses and adapt to specific dangers they may encounter, which is the adaptive immune response. They regulate blood pressure, heart function, wound healing. They regulate the body's inflammatory response. They regulate most hormones in the GI tract, influencing weight gain and weight loss. They directly activate pain nerve fibers, inducing pain, headaches, chronic pain, and a lot more. Mast cells live in the body's connective tissue. In the body, tissue is a group of cells that share general functions and together form organs and other body parts. And there are 4 different types of tissues. There's epithelial tissue, nervous tissue, muscle tissue, and connective tissue. And what connective tissues do, they do a lot too. They support all your organs and your cells. They transport nutrients and wastes. They defend against pathogens. They store fat. They repair damaged tissue. Connective tissue is a catch-all term used for tissues that hold your body together and link its different parts. Connective tissue is essential to maintain the structure of your body. There are different forms of connective tissue nearly everywhere in your body. Connective tissues form vital connections, supports, and links that our body systems need to work together. They are literally what holds our body together. And they take many forms and not always obvious ones, and they do jobs you might not expect. So there are some things that we don't usually think of as tissue or as connective tissue, bones. We tend to not think of bones as tissue because they're hard, but bones are made of hard, strong tissue that gives the body its shape and helps us move. Bones are made out of specialized connective tissue. Blood is another one. Technically, blood is a fluid connective tissue. Blood links nearly all parts of the body in some way, which means it counts as a connective tissue. Cartilage. Cartilage is a key connective tissue. It is essential for linking and supporting key parts throughout the body. Ligaments and tendons. These are both connective tissues. Ligaments link bones to bones and help stabilize joints, and tendons link muscles to bones. And the sclera, which is the white of your eye, is a type of dense fibrous connective tissue, and that's continuous with the connective tissue of the cornea. So when you think about, just in a really quick, briefly in a minute, when you think about all these places where connective tissue is, and all the places that hurt, get sore, that swell, that are involved in mast cell reactions when their mast cells are activated, it kind of makes sense that this is all the places where the mast cells live. It's where there's connective tissue. Makes you wonder, it makes it more clear, for example, with migraines, and sometimes people get that their eyeballs ache. the connective tissue in your eyes. So very interesting that. So we're going to move to what triggers and reactions are all about. Well, mast cell activation, basically in 4 steps. Step 1 is the activation. The mast cells have encountered a perceived threat or possible danger, something that they think could be. So the first thing that happens is they're sensitized. Is there really a danger there? And then bang, they're activated. Step 2 is they degranulate. The activated mast cells degranulate. They crumble. Step 3 are the mediators. The degranulating mast cells pump out hundreds and hundreds and hundreds of mediators, which are chemicals, into the body. And the mediators flood the body. When mast cell-specific mediators hit their mast cell receptors, the door, so histamine can only go in the histamine door, chocolate can only go in the chocolate door. Those substances, when they get through the receptor, when they go through the door, that's how they get into the body, and then the reactions start happening. So triggers. Individuals with MCAS or other mast cell activation-related issue or disorder can experience mild to severe reactions from being exposed to often very small amounts of chemicals or other substances or environments. These chemicals and substances are triggers. They trigger or bring on mast cell activation and the release of those mediators that lead to the reactions that people experience. The chemicals and substances to which a person can react vary from person to person, as do the specific reactions. However, each person will react consistently to their triggers. So this is a partial list of triggers. And it includes, but it's not limited to this. These are just some things that people can react to. A lot of people do, some people don't. Chemicals, plastics, metals, wood, paint, shellac, inks and dyes. There's lots of plastic in inks and dyes too. Exhaust fumes from cars and trucks and machinery, cigarettes, detergents. It's electromagnetic fields, car trees and air deodorizers and air conditioners and gas and oil heating systems and personal care products and yeast and ripening fruits and things being cooked and cooking spices, new clothing, new bedding, carpeting, additives in food, additives in medication, and having dental procedures, having medical procedures, having surgery. And there's a lot more. I'm sure there are each individual ones that each of us can add to the list. Then there are the reactions themselves. Reactions are the symptoms a person with MCAS or another mast cell activation-related issue or disorder can experience after they've been exposed to a chemical or a substance or an environment to which they react after they've been exposed to their triggers. Reactions can be mild to severe and life-threatening. They can move incredibly fast and in fractions of seconds be life-threatening anaphylaxis. Reactions can also be delayed and can happen and intensify hours, days, or even weeks after an exposure to a trigger. And reactions can last for weeks or longer, leaving the person dizzy, exhausted, in pain, with varying degrees of cognitive impairment, varying degrees of food intolerance, unable to work, and often with lingering GI distress, and whatever their specific reactions may be to their triggers. And a partial list of reactions includes, but again, this is a partial list: nausea, vomiting, diarrhea, stomach problems, food intolerance, cognitive impairment, brain fog, problems with breathing, nasal congestion, tongue swelling, airway swelling, hands and feet swelling, face swelling, rapid heartbeat, chest pressure and pain, tinnitus, the ringing in your ears, anxiety, panic, anger, emotionality, irritability, feelings that something is terribly, terribly wrong, feeling like this horrible feeling. They call it the feeling of impending doom, which is a big feature with anaphylaxis as well. Depression, feelings of despair, often of deep, deep despair, and suicidal ideation, fainting, blacking out, which is syncope, or feeling like you're just on the verge to, but then you don't, of passing out. Then there's numbness and tingling. There's the list. It's there's a lot. And it hits every organ system because mast cells are in every organ system, including the brain. Then there are issues and disorders that involve mast cell activation or have a basis in mast cell activation. Some of them we may not always be aware of. Some of them we are aware of. Some we have. A lot of them we may have. There's dermatitis and eczema, hives, the urticaria, rashes, dermatographia, which is if you kind of scratch on someone's skin and it, whatever the scratch mark you make, it can raise up and leave a red line, like you can write on your skin that it lasts and stays there. That's dermatographia. Then there's desquamation in the epidermis, big word. We all know, or many of us know, when we go to the beach and you get a sunburn and then later your skin starts to peel a little bit. Well, this is skin peeling like that, but without a sunburn, just randomly seeming, your skin will just start to peel. I've seen skin peeling on people's feet, on hands, no sunburn, and that's what desquamation of the epidermis of the skin, that's just peeling, and that's a mast cell thing. Fibromyalgia, migraine, stress, neurological pain, neuropathy, arthritis, allergies, acid reflux, bladder pain syndrome, diabetes, high cholesterol, totally independent of your diet. You can have high cholesterol because of the mast cell stuff going on. Osteoporosis, cystic fibrosis, restless leg syndrome, a lot of cardiovascular disease, Kunis syndrome, COVID-19 and long COVID, multiple sclerosis, autism spectrum disorder, Parkinson's, Alzheimer's, Huntington's, endometriosis, Crohn's disease, celiac disorders, Sjogren's, Ehlers-Danlos syndrome, thyroid disorders, glaucoma, age-related macular degeneration, and more. There are a lot more illnesses and disorders that mast cells are involved in. Every person is a world to explore, and that's very, very true. And I like thinking of it in that way because we hear so many times with mast cell things that it's so individualized, but we're all an interesting exploration. So there are challenges for the medical field. Non-mastocytosis, mast cell activation related issues and disorders like MCAS and being sensitive to multiple chemicals and long COVID and chronic fatigue and fibromyalgia and EDS and more, they don't conform to traditional approach of the patient goes to the healthcare provider with a complaint of symptoms. They have assessments and tests done, and the diagnosis is based on the assessments and the test results. And then the doctor says, here's what you do. Bing, you're cured, go home. A large number of diagnoses have success with that kind of one-size-fits-all curative approach, like a broken leg or a sinus infection or ringworm or pneumonia. But chronic illnesses don't fit that template. Chronic mast cell activation issues and disorders, which are chronic illnesses, absolutely do not fit that kind of template. Our current most frequently used medical approach is acute care based and acute care focused. And that's that model where doctor, I'm sick, here are my symptoms. The doctor, you get an assessment, whatever tests are done. Yep, here's your diagnosis. This is what you do. You're cured. There's no place for any chronic illness within an acute care focus model. There's no place for mast cell activation related issues and disorders. And many healthcare providers seem unable to step away from that acute care focused model. So there are also challenges for the medical practitioners. Typically, the training about mast cells that medical students receive over all of their combined years of schooling is about 1 minute, according to Dr. Lawrence Afrin, who is a mast cell specialist and a very well-known one. Compartmentalized thinking and training with each illness in its own little box, separate from the other illnesses, that's a part of the approach to medicine and illnesses and disorders that medical practitioners have. And when you're dealing with things that are about mast cell activation issues, they miss that mast cell activation overarching connection that connects all the dots and gives a lot of understanding to these other illnesses. So they're perceived unknowing about mast cells. And you hear, well, I don't know about mast cells, and that's a specialty area, and it's outside the generalist or the primary care provider's scope of practice, as the reason for their reluctance to diagnose and reluctance to prescribe. And because they don't have that overarching understanding of mast cells, they don't see that they are regularly diagnosing and treating conditions like allergies and eczema and hives and acid reflux and celiacs and Crohn's disease and Alzheimer's and Parkinson's and arthritis, which all have a basis in and or involve mast cell activation. Many, if not most, healthcare providers follow a managed care approach or a continuum of care approach. In both of these approaches, the generalist or the primary care provider is in charge of the care and makes the decisions regarding care, often not in true partnership with the patient. Mast cell activation related issues and disorders such as MCAS cannot be managed from the outside by somebody else, and they don't fit with the managed care model or the continuum of care model for the provision of services. And in case you aren't familiar with the continuum of care, this comes many times from agencies where they decide and they look at the human lifespan, and at this age this will probably happen, and at this age this happens, and at this age this happens. So they're looking at a continuum of care with prescribed moments of potential illness from the outside, and not from patient to patient individuality of care. And there's also challenges for mental health practitioners because the symptoms of mast cell activation are not always readily recognized by primary healthcare providers and are often mistakenly based on many times the lab results coming back within normal ranges, and they're thought to be psychological, and so people are referred to a therapist. Therapists are not trained to understand or recognize mast cell activation symptoms as being psychiatric seeming, which means they may appear to be psychiatric symptoms, but are actually the physiological symptoms related to mast cell activation issues and disorders. Anxiety, as well as depression, is a common symptom when mast cells are activated and they're degranulating. And this is a good example, anxiety. But when mast cell activation isn't recognized and the symptoms are attributed to psychological issues, people are often prescribed anti-anxiety medications. Many anti-anxiety medications are antihistamines or have antihistamine-like qualities. So the person with the unrecognized mast cell issue can exhibit an improvement in their symptoms because of the histamine blocking properties of the medication. Uninformed prescribers will think it's helping a psychological issue, and many patients who have been given a right-acting medication for the wrong reason also may remain unaware of their mast cell activation situation and believe what they're experiencing is all psychological and not understand why they're still not really feeling better and they still feel really sick, and it ends up being a misinformed kind of rabbit hole. So it's also important to note that having a mast cell activation related issue or disorder like MCAS and experiencing anxiety or depression as a mast cell activation reaction doesn't mean that a person can't also experience emotionally based anxiety and depression. So there is that individuality of health. And part of it, this is the compartmentalized thinking that I mentioned. Compartmentalization in medicine refers to understanding health and diseases through a lens of separation, as if each diagnosis that a person may carry is in a separate box or a separate compartment from the others. It represents a fragmentation of knowledge, of understanding, and it also represents a fragmentation in the provision of care. Through focusing closely on each compartment or specialty area, we lose the broader picture. Dots aren't connected, and ultimately people suffer. How can doctors and medical professionals correctly diagnose and appropriately treat something they haven't been trained to recognize and don't fully understand? And these are some of just the common boxes, and they're not boxes. Chemical sensitivities and having anxiety and the brain fog and the pain of fibromyalgia. The connecting thing is mast cell problems. And it doesn't mean that with the specific treatments for some of these issues and illnesses that you forego them. No, it's having the mast cell activation awareness broadens the array of choices and strategies and interventions to help support improving symptoms and feeling better. We don't always realize that there is a compartmentalization or understanding of health, and that there are basically three roles of ill health: the role of the sick person, the role of the healer, and the role of the support person. And this is kind of basically it across many, many different cultures. The role of the sick person is to get well. The role of the healer is to diagnose and treat the sick person so that they will get well. And the role of the support person is to support the sick person and to help them as they get well. So we have all internalized these roles. They're familiar. We understand them. The healer is kind of all knowing, has all the answers, and will instruct us as what we're supposed to do to get well. And there's a timeline, often unspoken, but it's understood, for getting well that the sick person is expected to adhere to. If the sick person doesn't get well in a timely manner following that timeline, then they are malingering. And malingering in medicine is intentionally playing it up and pretending to not be well when it's not the truth. The support person will often withdraw their support if the sick person fails to get well in a timely manner following that timeline. People get impatient. No chronic illness conforms to this getting well template, yet people with chronic illness are nevertheless expected to follow and adhere to it. And we carry these understandings within us and have this must get well expectation of ourselves. So we feel guilty because we don't feel good. We feel guilty because the fatigue is so bad. I can't even get up off the chair. I can barely, make it to the bathroom. And we feel terrible that we are being terrible persons. We're being just awful and selfish, and all of these things, all of these criticisms that run through our heads, and that recording that goes on behind the scenes in all of our brains. And this is a big chunk of where it comes from, that we've been taught that this is what you're supposed to do, and you're not following the rules. But chronic illnesses don't follow the rules. Highly individualized can sometimes have you feeling the equivalent of being told, there's nothing I can do for you. Highly individualized, often it means that something doesn't fit the established model for diagnosis, treatment, or care, and it leaves you feeling, there's nothing I can do for you. Many times it means to go see a specialist, and once more, leaving you feeling like there's nothing I can do for you. Within the context of highly individualized, there are still recognizable signs and symptoms of apparent mast cell activation and even commonalities. Symptoms of mast cell activation are recognizable once you know what to look for and once you understand a presentation of symptoms. Individuals may have a different array in their presentation of symptoms when reacting, but each person will react to their triggers according to their particular array of presentation of symptoms, according to their individual body when experiencing mast cell activation. So as an example, let's say there are 3 people who all have been correctly diagnosed with the mast cell activation disorder. Person A might react to a particular laundry detergent with intense cognitive issues like brain fog, and with dizziness and with migraines. Person B might react to the same laundry detergent after being exposed to it with extreme fatigue and bone, muscle, joint pain and heart palpitations and their heart skipping beats and extreme emotionality. Person C, when exposed to the same laundry detergent, might not react at all. Highly individualized doesn't necessarily mean unrecognizable or undiagnosable. Being brave. It's a huge and intense, and it's big, what that entails, because the world of mast cell reactions, when it's really bad, can be very scary. And in the mast cell universe, where time moves so much more slowly, when it comes to being brave, education is key. Learn about mast cells. Learn and listen to your body. Learn your reactions, learn your triggers, learn your protocols and strategies, what works for you. Know who is on your health team. Know who is on your support team, and learn and know who you trust. Communication is big with understanding the strategies for mast cell reacting and being brave to try with the medications and the reactions that can happen sometimes just because you just put a pill on your tongue and you react. Communication in our body happens at multiple levels through various routes, through our senses, our hearing, our vision, through cell-to-cell communication, through touch, through taste. Our brain is the processing hub. It is in a constant state of reception, receiving information from inside our bodies, from all of our senses, and from our external environment. It is a vastly complex system of meaning-making that involves in-the-moment data as well as memories and associations. How our brains talk to our body and vice versa Information comes from our sensory neurons to the spinal cord, up through the spinal cord to the brain. The brain receives these signals and interprets them, which allows for our perceptions and our responses to those perceptions. The brain communicates with nerve endings to process and respond to emotions through a highly complex network that involves sensory input, specific regions of the brain, and bidirectional signaling. There are 12 pairs. In addition to all the nerve endings going everywhere, there are 12 special pairs of nerves, and they are cranial nerves. And they play a vital role in the nervous system, and they orchestrate many functions of the body that are vital for our everyday life. Cranial nerves communicate directly with the brain, and they don't send any information through the spinal cord. So whatever happens with cranial nerves, they send that information straight to the brain. The vagus nerves, which you may have heard of, are cranial nerves. They're involved in multiple body activities, including respiratory, heart, GI. The vagus nerve is associated with mood regulation and our stress response, the fight, flight, freeze response. And it is crucial in maintaining the body's overall physiological balance, homeostasis. Our brain learns. The brain learns and remembers in order to communicate successfully. The brain learns through our language, and language is a broad and multifaceted tool. It's used to communicate, to make meaning, to understand everything. And language relies on memory for the storage and retrieval of vocabulary, grammar, syntax, of how we make meaning. Memory benefits from language as a tool for organizing and recalling information. So our brains learn to recognize our emotions, things that we see, information that comes from our touch and taste, from our sense of smell, our hearing. The brain learns through our emotions. The brain attaches words and labels and descriptors. Emotional states significantly influence the encoding, how the associations, the storage, and the retrieval of memories. Strong emotions enhance the consolidation of long-term memories. And the brain's amygdala processes emotional significance, and it interacts with the hippocampus to prioritize and strengthen memories based on emotional relevance. And you're going to be hearing more about the amygdala as we go on. It does a lot. Mast cells communicate. Mast cells are sensitive to what's going on outside and inside the body. Mast cells are present in the tissues that are exposed to the outside world. They are wherever, our skin is coming into direct contact with the environment. Mast cells are there. Mast cells are present in the meninges that cover the brain and in the central part of the brain, especially the hypothalamus that regulates homeostasis, which is, again, the body's being in balance, and the amygdala that regulates behavior. Mast cells communicate with the hypothalamus. The hypothalamus communicates with the pituitary that makes all the hormones. And that communication with the pituitary happens via a small bridge that they call the median eminence. Quite the name. The median eminence is this very, very, very small stalk. It's tiny, teeny tiny, but the number of mast cells that it has per unit of volume is more than the number of mast cells that we have on our skin per unit of volume. So there are a ton of mast cells doing things in our brain. And we have a direct role in our brain's communication with our body. We train our brains. That's called the plasticity, neuroplasticity, in what our experiences mean about our emotional landscape, how to understand the sensory input regarding our external environment, and to assign, understand, and make meaning regarding all aspects of our internal world of health, wellness, illness, and change in our bodies. Mast cells are involved. They are key intermediaries between the nervous system and the fear response. They communicate with nerve endings in both the brain and throughout the body. They help to initiate and amplify what happens in the body associated with stress and fear. And I know it's going to come up the word bidirectional. In the body, cells are very specific. So if there's some sensory input coming from through our skin, there are cells that will take that message, that information, and carry it to this other type of cell. And that second type of cell will be the ones responsible for engaging in action in response to this information. So it's like there are specific cells they each have their little role in the messaging and the communication relay. But mast cells are different. Mast cells do it all. This is the bidirectional. Mast cells are talking to all of our nerve endings all the time, everywhere. And they can take information and they will tell all the other cells in the body what to do. And they will also take the information that they're getting from other places in the body and relay it back to the nerve endings. So if the mast cells are giving incorrect messages and incorrect information, which is what appears to be happening with MCAS, then that's why it's a systemic reaction everywhere. And there's storms, and it's never just one symptom that people experience when they're having a reaction. It's systemic. So the brain gets information about fear because understanding the fear response is part of this. When sensory input, like through sight or sound, is processed by the amygdala acts like the brain's threat detector. The amygdala triggers the fight-flight response, and it happens very, very, very quickly, fractions of seconds. And it's like the alarm system for fear. Mast cells communicate with the amygdala. The amygdala can directly influence the sympathetic nervous system, which controls the fight-flight response. The stress of the event combined with the norepinephrine that the body releases in the moment can help to can just burn that fear into our memory, making it easier for our brains, our cells, and our bodies to remember that sensory data as a threat and always respond to it as a threat, because cells remember and mast cells remember. And when mast cells encounter something they perceive as a threat, and if they remember a previous encounter that they had with what they see as being the same threat, they will respond in the way that they did before and hit even harder the second, third, fourth time around. So if sometimes you're wondering why it seems like reactions are worse when you're exposed to something, well, that's why the mast cells are responding even harder. And why it seems like it's ricocheting off itself. It can feel like that. The reactions start ricocheting off themselves. It's that communication and the bidirectional communication with the mast cells. So the fear threshold is a point at which a stimulus is intense enough to cause a fearful or anxious reaction. And the fear threshold is linked to mast cells, which can be stimulated by stress and environmental triggers. And this stimulation can cause mast cells in the brain, especially the amygdala, the region of the brain responsible for fear processing, as well as behavior and emotions, to release inflammatory mediators that disrupt the neurons and the connections and potentially alter the normal fear response. And then add to it chronic stress and sleep deprivation, because it's always trouble sleeping and the stress are a part of so many mast cell related issues and disorders. It can exhaust the nervous system, which lowers the fear threshold and makes a person more vulnerable to anxiety, panic, and fear. So when you lower the fear threshold, it takes less to trigger that huge response. Memory, mast cells, and the fear response. Memory and the fear response are deeply interconnected. The brain uses past experiences to inform its reactions to perceived threats in the present, and there is a strong bidirectional link between associative fear memory and mast cells. Stress from fear conditioning activates mast cells. So whether it's, if it's, the fear may not be based in a real threat, it can be a miscommunication from the mast cells, but it's running with it. And the stress from that is going to be remembered, and it's conditioning, it's training the mast cells and our brain to always want to respond in this way to this stimuli. The activated mast cells, through the mediators they release, can alter brain function and regulate the strength of fear memories. And I mentioned the conditioning, which is how we train our brains to recognize something as being a fearful and a threat. So the example, let's say there's a lovely image, picture of something peaceful and beautiful, and it's paired with a negative stimulus, like a huge, loud, horrible noise, like fingernails scraping on a blackboard and just deafening. So if you pair that together, have those both happen at the same time, the amygdala in the brain is activated by the loud noise. And when the image and that horrible, horrible loud noise are repeatedly presented together, the pathways in the brain connecting the two are strengthened. So the brain is going, oh, these are connected, these are connected. And after repeated pairings where they're seeing the image and hearing the horrible noise at the same time, then it can be, all you have to see is the image, and bang, you'll have the fear response be triggered, because the brain has been conditioned, trained to respond with fear. And we don't realize many times that we are training. There's a level of fear and upset that we are because it is scary, because it's, oh my God, am I going to end up back at the hospital? Is my airway going to swell shut? Do I need an EpiPen? All of these things, I'm not trying to in any way diminish the very real fear, but hopefully with some strategies that we're going to talk about, it'll be a way of not reinforcing the fear and not conditioning a fear response, which can help when it comes to the taking of the meds and not being afraid to try. So we got to remember, we teach our brains what meaning to make of our experiences, and we teach our brains how to respond and how to react. And we communicate with our body at the cellular level, and all cells in the body communicate, and mast cells communicate. So in this mast cell universe where time really does move so much more slowly and things seem to take so much longer, brave isn't an absence of fear. Brave is feeling the fear. Brave is moving forward in spite of it. Brave is equipping and arming yourself with knowledge to support your health. Brave is coping ahead and preparing in advance. Brave is understanding that many times repetition is essential in retraining mast cells and in managing symptoms. And brave is believing in yourself even through the storms. So we're going to look at some treatments, and we're going to start with tools for the toolbox. So here's a little mini roadmap with the treatments part of it. We're going to look at toolbox, some medications, we'll touch on emergency protocols, and a little nod to food as medicine. So what goes in a toolbox? Each person's toolbox is highly individualized, but here's some things that go in mine. I thought I'd just share it because it's important to know that you do whatever the strategies that you have, that you are aware of, that help in your world, write them down, make a list of them, because sometimes when I'm reacting, the brain fog can be killer and I won't remember what my toolbox, where it is and what's in it. So I make lists of things, and I know like where I put my binder, and here's my list of things, and here's who I can call, and here's what I do if I'm having really bad reaction. But so this is just as a place to start thinking. I'm not saying everybody's needs to be like this, but medications, I have maintenance medications that I take regularly, and I need to know what they are and make sure I take them. Sometimes the brain fog, it's like, did I take anything today? So strategies to help me remember. Not everybody takes medication. That's fine. It's whatever that it is that works for you. Then there are emergency medications, the ones just things that need to be, if I have to go to the emergency room, I have a letter that I have printed out that my doctor signed that says, this is what I have. Don't do this. This is what you need to do. This is what you need to do to not make me worse. And I bring it with me. And if I have to go to an emergency room, also when I go and have things like my COVID vaccine and stuff, I bring it with me going, here's what you do. Here's what you need to know about me. Food as medicine is huge if you start paying attention and looking at it as you can specifically take. There are foods that are known to be mast cell strengthening foods that help inhibit mast cell degranulation and mast cell activation and inhibit the different mediators. And I know food can be a huge area of challenge with food intolerance, but if you still have an awareness, and as you're able to add maybe more foods and try to make choices that are mast cell stabilizers that work for you, that's another potential tool for your toolbox. Then there are the things like the vagus nerve informed strategies and breathing, which we're going to get into, and circadian rhythm awareness and stress management strategies, and exercise if tolerated, because that can help retrain mast cells in all the things that work for you. But it's important to have the toolbox and to remember that it isn't just using one at a time. It's hitting your body with everything, because it all helps to get the message through the mast cells. Nope, chill. This is not a threat. I don't want you to react. So the first line of treatment medications for the symptoms of mast cell activation include histamine 1 receptor blockers, histamine 2 receptor blockers, cromolyn sodium. I know it's called something else in the UK. That's what it's called in the US, and it's on the next coming up slide, what it's called in the UK. Then there's ketotifen, there's aspirin, there's prednisone, and epinephrine auto injectors. These are all medications that help. So specific medications, the first generation H1 receptor blockers, like diphenhydramine. Sometimes it's also called Banafen or Benadryl. Xyzal is another one, hydroxyzine. H1 receptor, the receptor blockers, there are different types of histamine, and H1 is a histamine 1. That's a particular type of histamine. So, and I mentioned when I mentioned receptors that like only chocolate can go through the chocolate door. Well, histamine 1 can only go through the histamine 1 door. Then there's histamine 2, and it can only go through the histamine 2 door. They've, I think, at this moment in time, pinpointed 4 or 5 different histamines. But histamine 1 receptor blockers are these, and then like Claritin and Zyrtec and fexofenadine, these other medications, and they're histamine 2 receptor blockers, and those tend to be stomach and address things, but they still do help systemically. So it's Pepcid, famotidine, and Zantac, cimetidine, and Axid, which is by prescription only. Histamine 3 receptor blockers tend to be Parkinson's medications, and histamine 4 receptor blockers are usually cancer medications. And you see those more with people who have mastocytosis and in their treatment toolbox. Then the mast cell stabilizers, cromolyn sodium, which is sodium chromoglycate in the UK. See, I knew I had it, what it's called in the UK. So it's oral, nasal spray, eye drops. It can be as a powder, it can be compounded that then you would mix it with water and drink it. There's ketotifen, prednisone, aspirin, montelukast, which is Singulair. These are all mast cell stabilizers. Then there are vitamins and minerals and spices and supplements. Vitamin C, ascorbic acid, it inhibits the histamine release and helps to stabilize mast cells. Vitamin D is a mast cell stabilizer, and research has shown that vitamin D deficient environment, mast cells degranulate automatically even in the absence of specific triggers. So if you have vitamin D, it inhibits histamine release. Vitamin E has been shown to have an inhibitory effect on the secretion and survival of mast cells. Studies have shown that vitamin E affects mast cell activation, resulting in decreased release of pro-inflammatory mediators, including histamine. So vitamin E is good. And always check with your doctor to see what can and can't work for you. Then zinc deficiency has been demonstrated to affect the function of various types of immune cells, including mast cells. And it seems to be essential for mast cell activation. So these are more areas to explore. Then there's quercetin, which is a flavonoid, and it inhibits mast cell activation and histamine release, and luteolin, which is a flavonoid that inhibits mast. So Dr. Theo Harides has found with his extensive research that quercetin and luteolin together are more effective mast cell stabilizers than the cromolyn sodium. And quercetin and luteolin are found in a lot of foods. So again, that's where the food as medicine comes in. You can specifically target what foods, maybe you can tolerate them. Do they have quercetin? Do they have luteolin? Things to explore. Turmeric has anti-inflammatory effects, and it's been reported to inhibit mast cell degranulation. Cinnamon, fatty acids, specifically ones found in fatty fish like salmon or herring, they can influence the production and secretion of mediators by mast cells. And if we can inhibit the production and secretion of the mediators that are bringing on our reactions, then we'll be turning down the volume, hopefully, on our reactions. There are also amino acids and carotenoids. And then there are supplements. There are a lot of things, the amino acids and the dark green leafy vegetables. I find the red leaf lettuce makes, oh my gosh, that with arugula makes a huge difference in how I'm feeling and my reactions. So there are a lot of things I can't eat. Another person that I work with, green cabbage, has been amazing with him, as has been blueberries, raspberries, and mangoes. So it's really exploring what can you and can you not tolerate, and seeing what may or may not help. And it's not always easy to tease it apart, but food as medicine should not be ignored. And then emergency protocols. Mast cell activation symptoms, and it's important that people know this, and they know this in the emergency room, that can quickly disintegrate into anaphylaxis. So everything that happens should be to expedite treatment, and simple symptoms should never be overlooked nor treatment delayed. And many times, if you go into an emergency room setting and you're saying, my tongue is swelling, and a nurse will look and say, I don't see your tongue swelling, and you're not listened to. So it's important to know that you are the expert in what's happening to you, not an external person. So additional doses of histamine 1 and histamine 2, the antihistamines, may be needed to control symptoms even after the acute reaction, and even after you've had an EpiPen. Sometimes it may take more than one dose of the epinephrine, the auto inject, sometimes 2, sometimes 3. But just know that it can come back. So it used to be that if you had to administer one of those auto inject epinephrine pens, you'd need to go to the emergency room and wait 4 hours to make sure that it didn't come back and be worse, or just come back at all, the reactions. Lately, they've been saying you don't have to do what you think is best for you. So controlling your environmental temperature, and in stress, they need to know that to avoid setting off mast cell reactions, because too cold, too hot, and the stress can all set off reactions or intensify reactions. And check all medications, including ones that you're getting, like that you might be getting through an IV, to make sure none of them have alcohol or preservatives. And another thing, if you are in an emergency room and they want to hook you up, to make sure that they use old tubing, because the newer plastics can be provoking of mast cell reactions. And all standardized emergency protocols should be personalized as needed, because each person is different in what works for them and what they can't tolerate. Again, food is medicine. The role that food and food choices play in the health and wellness of a person who may have MCAS or another mast cell issue or disorder is huge. It's enormous. So making informed food choices that focus on supporting areas of health and wellness specific to mast cells is a vital tool for each person's mast cell activation aware toolbox. And so hopefully, and I know food is a very difficult universe of and by itself. So hopefully that will be something that can be stuck with. So some of the strategies, here's another little mini roadmap. We're going to look at, again, the communicating with your body and your mast cells and the vagus nerves and oxytocin. I don't know if you know about the mammalian dive reflex, and some bilateral stimulation and stress management. And again, the things that work for you. So here's a little quote, because that was a lot of information I just shared. That invite your fear into consciousness and smile through it. Every time you smile through your fear, it will lose some of its strength. I like that quote for 2 reasons. I like the spiritual part of it, just, being a little zen, smiling through your fear, but also that it's directly speaking about cranial nerves, your vagus nerve, and your facial nerves. And we'll get to that. So vagus nerve informed breathing. Vagus nerves are cranial nerves, specifically cranial nerve 10, which means they are in direct communication with the brain, and they are in charge of turning on and shutting down the fight-flight response. So research has found that breathing in a particular way overrides the fight-flight message and sends the exact opposite message, rest and digest, to the brain. So when you inhale, if you emphasize the exhale, and then at the same time, while you're emphasizing the exhale, make a little noise. You can kind of go, ah. That's what does it. The emphasizing the exhalation and making a vocalization at the same time. Then they also have found humming, gargling, and singing. The vagus nerves that pass by your vocal cords. So humming, gargling, or singing can stimulate the vagus nerves and induce a calming effect. So by all means, sing. And then smiling. The facial nerves are cranial nerves as well. And the primary cranial nerve involved in smiling is called cranial nerve 7. And it controls the muscles that are part of the facial that make you smile. Raise your mouth and wrinkle your forehead and puff out your cheeks. The whole expression of a smile. That's cranial nerve 7. It's in direct communication with your brain, and it's telling your brain, we're happy, everything's okay, the opposite of the fight-flight response. So if you can do the breathing and sing and put a smile on your face, you're giving your brain this intense message, everything is good, shut down the fight-flight response. And it changes the fear message to a calm message to rest. And if you can't feel like smiling in the middle of it, if you take a pencil or a pen and you put it horizontally between your teeth and like grit your teeth, that's basically the same muscle arrangement as a smile, and your brain will think you're smiling. You can still be like, ah. And when you do this, it's not like it's going to happen immediately. Like immediately, everything's going to feel good. It's repetition. The more you do it, you're teaching your brain and your mast cells, you're overriding the fear, get upset, that response to it having it be a relaxed response. Oxytocin is a hormone that's associated with a bunch of things, but among them, they're associated with bonding and attachment within social relationships. The fight-flight response is driven by stress hormones like adrenaline and cortisol. Oxytocin is released as part of the tend and befriend response. In stressful situations, it can promote behaviors that reduce the fight-flight response. So tending, it involves nurturing and calming and protecting like one's loved ones or children or other vulnerable individuals in times of stress, taking care of them. And befriending refers to the creation and maintenance of social networks to provide protection and support during a threat, how we need each other when things are upsetting. So both of these are part of the tend. This is the tend and befriend response that oxytocin release triggers. So things that will can boost your body's oxytocin. Hugging, 20-second hug can significantly increase oxytocin levels and lower cortisol levels. Cortisol is a stress hormone. Just giving a hug and getting a hug. Cuddling the loved one, a child, your pet, promotes feelings of affection and safety, boosting the oxytocin. Getting a massage, if you're able, you don't have to go somewhere. I mean, even if you can tolerate some people, pressure can be a trigger for a reaction. So it's always be aware of your body. Don't do anything that doesn't work for you. But soothing touch activates the neural pathways and they signal oxytocin release. Petting your pet, just looking at your pet and petting your pet, just that little gaze that you share, whether it's a dog or a cat or my little bird, it stimulates oxytocin. Ooh, there's a typo. And physical contact, hugs, and more also boosts the body's oxytocin production, which will help manage the fight, flight, and the anxiety and the fear. Cold exposure, I'm including this because it's interesting to know, but at the same time, it's super, super important because a lot of people with mast cell issues are sensitive to temperatures, whether hot or cold, especially cold. And if you shouldn't do this, and absolutely not, if at all, and talk to your doctor. But so I'm not saying, this because this is using cold. But if you understand, just having an understanding of that cold can have a positive effect. Again, always check with your healthcare provider. It can either trigger a mast cell activation or it can inhibit it. Take no chances with your health. That being said, in addition to vagus nerve stimulation through breathing, another technique that can shut down the fight-flight response or help in turning down the volume on it by activating the body's parasympathetic rest digest is cold exposure. So a splash in the face with cold water, holding an ice pack or holding an ice cube in your hand briefly. Finish a warm shower with maybe 20 seconds of cold water. Putting an ice pack or a bag of frozen vegetables or a cold wet towel to your face, especially around your eyes and your cheeks. So it works because the reflex is triggered by contact with cold water on the face, especially around your eyes and your cheeks. And this stimulates the vagus nerve. And the physiological calming effect of slowing the heart rate can help reset the body's stress, fight, flight response. And then there's binaural music. Sometimes you can hear like binaural beats that's around. Research has found that if you stimulate both hemispheres of your brain, the right and left hemispheres at the same time, it helps to bring down stress and anxiety and also helps with depression. So, when you listen to the music, it's kind of a little earthy, crunchy, but it's not horrible. You have to listen to it with headphones or earbuds in, or else it won't work. So you just put it on, and you can find it online on YouTube. Also, the link in the bottom, and you'll be having a copy of this PDF, the PowerPoint PDF, the link to my website, because I have a bunch of tracks on there too. So you can check it out and see if that's something that can help. So it's important to override the message of fear, of threat. And these are some strategies that I just mentioned, like listening to the binaural music before you're going to do something, during and after. Now, I'm speaking with this particular slide specifically about taking meds, because the reactions that we have when we put a medication in our mouth, again, it's multi-layered. It isn't necessarily reacting to the medication itself. It could be reacting people's mast cells and the incorrect messages they may or may not be sending can be very unpredictable. So for some people, just putting anything in their mouth, they'll react to it the first time because the mast cells are hypersensitive and sending out a wrong information message. Sometimes if you eat something or drink something, but eating helps, a food that you know is safe for you. If you start having some of it before and you eat a few spoonfuls of it and then swallow whatever the medication may be and continue eating the food, you're giving the mast cells, they may start to react, but with the food, you're overriding the message with something that they know is familiar and safe. Sometimes that has been successful with people. Sometimes people will pre-medicate, like take some Benadryl first and then do that with the food. It's all about finding what works for you. Talk with your doctor about it. Listening to the binaural music while you're doing the eating and it helps to just bring down your stress level so that you're not telling your body, okay, we need to be upset about this. We need to be upset about this. Using all the tools in your toolbox. Again, talking to your body, because your body reads your emotions. And if you can try and keep your emotions not in a frantic space of fear, then you're giving a message to your brain, your mast cells, this is not fearful, calm down. Our cells remember past experiences, our body's past responses to those experiences, and our mast cells remember. So again, this is talking to your body. And these are some strategies for managing stress, because that management of stress is very important. So visual arts and visualizations. What you see can visually alter and influence what the brain is perceiving and processing. When you're anxious, your brain's attention processes are more strongly influenced by our emotional cues, which can enhance our perceived, it changes our clarity, what we think is going on, and the information that's being sent to our mast cells in our body, and can intensify the reaction. And that's the exact opposite that we'd like to have happen. We're looking for ways to not intensify the reaction. So these are just some ideas, whether you're completely absorbed by an artwork, a film, vividly recalling a visualization, whatever it is. If you remember something and you remember something intensely and vividly in that moment when you're remembering it, our brain thinks that that's what's happening to us in real time in that moment and will respond accordingly. So if you have something, if it's a picture, something you can look at and it brings back all of these intense, or has these positive, intense connections to it, that can help to be a way to not condition our brains and our mast cells to respond in fear. Even when our visualization is a memory, if it's an intense memory, our brain thinks it's happening and it can't tell the difference between yesterday and now. So we want it to think that it's in a positive space. ASMR is another autonomous sensory meridian response. It's another approach that people may or may not enjoy it. There are different approaches to it, using sound as well as visual situations to be calming and it triggers tingling, a sense of tingling all over, like your skin and your scalp. You can feel tingling, and then it's accompanied with feelings of relaxation and calm and well-being. It might be something you might want to check out. When you go, like if you went onto YouTube, there's tons of different ASMR things. Some of them are quite naughty and not what I was thinking of with it. There's a whole range of ASMR. You might want to check with the Midnight Mast Cells website link there if you want to check it out, because it might be something that you find relaxing and calming. And that would be something to use in the midst of trying to take a medication to reinforce the calm message that can help have maybe a reaction not be as intense. So it's all about creating new neural pathways. Don't rush. It takes time, repetition, repetition, repetition. And think of the positive emotions. You're connecting with the new habit instead of reinforcing the fear and the anxiety. Little strategies on this slide. And this last quote, again, a Thich Nhat Hanh quote, and it kind of sums it up. When we recognize that we have a habit of replaying old events and reacting to new events as if they were the old ones, we can begin to notice when that habit energy comes up. And we can then gently remind ourselves that we have another choice. And that's what it's about. I wish that it was as straightforward as, here, do this, and you won't be, this is being brave and it'll be fine with the medications, but it's involved. But if you understand how the body works and make choices with intention and with insight and with patience and repetition, it does start to change. And I organized the references by what they're about to make it easier. And then at the end, if you're curious, it has the different artists and who they were on the different pages.